My leg hurts. My stomach hurts. My back hurts. My head hurts. We've all said this throughout our lifetime, but we don't immediately go to the doctor, do we? We put band aids on things. We wait it out or use home remedies. Hello, everyone. My name is Joseph Gonzalez, and I believe the reason why we don't go to the doctor is because of our healthcare system. I think it's time we take a deeper look into nationalizing healthcare. Now, bear with me, we can do this. We're essentially already doing it. I just need you to be open to the idea of change. I've had multiple insurance plans for me and my children, from unions to private companies, through work, and through the military. Now, I've bounced around from plan to plan because some were better than others in certain situations. To kind of give you an overview of things, I'm going to go over why we need insurance, different types of ways that we typically get it, how covering us all would essentially help us all, and how we can begin to start the process of changing things. Most of us aren't Jeff Bezos, founder of Amazon, owner, CEO, what have you. We can't just walk into a hospital, purchase it, and then have them take care of us whenever we have a headache. So this is where the why we need insurance comes into place. In 1986, the Emergency Medical Treatment and Active Labor Act was put into place. Why? Well, the American Journal of Emergency Medicine let me know that patients were getting dumped off from private hospitals to public hospitals, even when they had life-threatening situations going on. Now, the act makes it so places with emergency services can't deny someone based on religion, race, gender, or their financial ability to pay. Now, not every injury is life threatening, so you can't go and get treated at a hospital for something minor. Or if they reattach your leg, who's going to help you learn how to walk again? The follow ups, the after events, they can deny you for things like that. In this world, nothing can be said to be certain except death and taxes. It's a famous quote by Benjamin Franklin. Now, taxes get taken out of my paycheck. I don't know about anything preventing or delaying the death. Let's take a look at the different type of insurance plans that are offered and how we get them. You can opt in to get money taken out of your check for medical, dental, and vision from your employer. Typically, you have to be a full-time employee. If you're not or can't afford it because it's too much, the government offers you some. But they use words like HMO and PPO, and the Journal of Family and Economic Issues also informed me that not many of us are literate in that sense. All these terms, the different plans, how one is more than the other, but there are deductibles that put into place. So you have to get hurt or get sick for a certain amount of money before they start covering it, even though you've been paying. Now, there are also those gray areas where I'm not poor enough to get Medicaid through the government or Obamacare as it's called, and I don't make enough to be able to afford insurance from my work. People get desperate and do crazy things. Uh, kind of lesser known example is the movie John Q with Denzel Washington. His child gets denied a heart transplant because of his insurance. So he holds up a hospital, forces them to fix him. There are real life cases of that throughout history. And it's crazy because almost all of us are already paying for insurance. So how do we change the way things are? The average monthly cost of healthcare in Nevada is $566. What happened recently? COVID-19. And because of COVID-19, the government acted quickly to push legislation, and money seemingly came out of nowhere to take care of each other. So most of us are already taking money out of our checks to pay for taxes for those who can't afford healthcare and for our own healthcare. Then the government showed that they can pass things quickly when they have the urgency to, or it's an election year. So voting and holding the politicians accountable for the promises that they make on their campaign trails to get our votes is another important piece of changing things. We can do this. We're already essentially doing it. We just have to be open to the idea of change. We know that there's a problem and that we need insurance. We have to educate ourselves on different plans and ones that work and how that could essentially formulate a plan for the whole country. And we need to vote on policies and hold the people accountable on the promises that they make to us for our vote. I don't think it's right that people should have to decide on whether or not to pay their rent or take their kid to the doctor, worry about putting food on the table or a lingering cough for their parents. Thank you so much for listening. And please take this into account the next time you go vote. Have a great rest of your day. Let's stop putting band aids on our big problems.